First of all, thank you to be here with us. Today, my role is to introduce the injectors, Alejandro and Tom. Tom is here with me. Alejandro is already in the injection room. But just a few words about this amazing product named RENÉE. RENÉE is a monodensified hydrogel created with hyaluronic acid. Why we are here to speak about a monophasic, monodensified hydrogel based on AHA? Because the technical characteristic of the product give to the line an amazing mechanical property, especially in the cohesivity. The rheological property of the line could be used like could give you the possibility to use the product like a liquid endoprothesis. The vertical lift that you can create working with this amazing polymeric matrix of HA is fantastic. So working with some particular references like 28, 26, we can lift the tissue injecting heat in some particular anatomical area. In the opposite, working with another references, prime, 18 milligram for milliliter, so low concentration of HA with soft cross-linking, we discovered that we are able to have an interaction, an incredible interaction with the extracellular matrix. We are able to promote a mechanotransduction effect. We are able to stretch the fibroblast to promote new glycosaminoglycan and new collagen in a physiological way. So if it's true that now is fashion to speak about biostimulation, we know that to biostimulate new collagen production, you can use what you want. Also, silicone is able to produce new collagen. Unfortunately, we are researching a physiological and natural way to produce new collagen, to produce new glycosaminoglycan. And we discovered that particular composition and concentration of HA in a hydrogel matrix can do heat very, very well. And this it will be the story for this year, the scientific story for this year. But I don't want use time to the injectors. So Alejandro, are you ready to show us your technique?
You hear me?
Alejandro?
Yeah.
Great. Can you do an assessment of the patient and show us which it will be your aesthetical correction program for this type of patient?
Okay. Thank you. Hello, everybody. I'm Dr. Alejandro Coello from Mexico. And right now I treat the forehead and the temple area. The patients apply only in the lips hyaluronic acid. They never apply in the forehead. We see it's very, very particular in the patients that you see the flat area in the temple area. So it's the very difference in men and women that we have a very flat part in the temples. But in females, it's more rounded. It's about the bone, the skull. So in these cases, we see very, very pronounced, it's here, okay, very pronounced the superciliar area and the flattened area in the temple. So if we start every patient that needed start in the temple area to have this kind of lifting of the forehead and then continue in the middle third and then the lower third, you have a very improve all the face. It's very important to remember that have very important arteries here. So we started obviously the external carotid to go it, upside, and then the zygomatic artery, the maxillary artery, and then continue in the superficial temporary artery. that I represent here, going. In some cases, we see the artery in in this case of the patient. We see that. No, it's very, very important to see. If you don't feel very comfortable right now, we use ultrasound to know the deepest or superficial arteries, and we go more safer. I don't think in the risk of the procedures is always there. So we need to improve these parts to have a very good results. So and safer. So we here see the superficial temporary artery that is very lateral and continue in two branches, one of the superciliar, one in the upper forehead, and the branches that go to the superciliar anastomosis with a supratrochlear artery. So in this part, when we treat this area, we do it with a cannula, the arteries going more superficial, not deeper, so that if we treat all the forehead, we need to go deeper with the cannula to improve this part. In the deeper of the temple area, we have the temporal artery, the superficial temporary artery, but we have the deep temporary artery. In some papers, this artery that coming into starting the maxillary artery, it's two branches deeper, 10% going in the bone, and 90%, it depends on the patients, going in muscular areas. So we need to go very deep with a 1-inch needle, a big needle, to touch the bone and start the application. In this case, we need to start in the deeper, and then continue with cannula in the superficial part. I use the gunshot technique. I love it. I think it's one of the techniques that have a very good results in deeper temporally improvement. So we need to touch the temporal crest, 1 centimeter up, 1 centimeter down, and we feel a little fossa there. So we need to touch the bone and step there. It's very important that the bone is not very solid, the temporal bone. So when we continue touch the bone, we stop, don't push very, very hard. It's very, very important, because we have in the literature 2 articles to have cerebrospinal liquid in the syringe. So you touch the bone, the feeling is very, very characteristic in the temple area. So when we touch the bone, stop and continue start the applications with very, very good results. And then go to the superficial. I'm working in this area. If we see, it's a very long area that have a need to improve volume. We started in the middle cheek, no, and all the temporal crest, and define the temporary bone. So we start application here, and then started my point with this.
So, Alejandro, you
Yeah.
are using 1 up, 1 over technique.
Yeah,
correct?
1 out, 1 over. Yeah,
So,
love it.
1
up, 1 down. Right.
fantastic. So, our our doctors are asking themselves which kind of product we will use, Alejandro, and
I asked him
why,
to.
and which is the difference respect this product respect all other products in the market?
It's very important. You use it lift or use it volume, 26 or 28. Why the reason? The product are awesome. Very small amount of BDDE. The cohesivity is perfectly no, and we need to use a voluminizer. It's very important when you treat deeper in this area. You need to use it voluminizer, or in our case, 26 lift or 28 volume. Why the reason that I decide one of
And
other?
in your experience, Alejandro,
Yeah.
how much it will be the quantity of product that you will need to fill, to volumize, to lift this big area that you describe?
In this patient, for example, I need 1 syringe, maybe 0.8 each side.
So this is a game changer,
Yeah.
because usually we use more products with some competitors.
Yes. The quality of RENÉE is awesome. Really, I've used it very less quantity to improve very well the
And
results.
tell us why this is possible.
Why the technology of RENÉE don't have any filler in the market. Is the G prime is hard to spread very well. The viscosity of the product, you need to see just a little bit of the product. If we apply just a little bit, you see the filler there, and it's don't touch, and then return to the syringe. This is not possible with any filler. This talking about the viscosity, and it need a very less quantity. It is very important. Maybe in with other fillers, the patients need 3 syringes per side, 3 syringes. Here with these patients, we use it maybe 2 syringes in both sides, not each side. So we see the projection of the area very well. It's very important to use it a big needle, not use it a small 13, no, because the zone, all the 11 layers of the temporal area is big, no, to broke the muscle. It's big, so use it a big.
I'm totally agree with you. The unique rheological characteristic of this monophasic, monodensified hydrogel, especially the great cohesivity, can lift the tissue in incredible mode. So sometimes you need half quantity of substance respect competitors to lift the tissue. This is possible thanks the balance between viscoelasticity and cohesivity.
And I think, Nicola, that we have a lot of products in the market, in the field,
Yeah.
a lot of them. This filler is very different. I told my peers that use it, prove it. No, see the projection that you have it with 1 syringe. They feel very smooth in our hands. So I really like it. I really love it.
You
projection.
probably will pay a little bit in extrusion force, probably,
Yeah.
but this is the fee that you must pay to have in your hands an amazing filling products.
Amazing, really
Okay.
amazing. We start with use it RENÉE Lift, 26 milligrams per hyaluronic acid. Because why the decision that don't use volume? Maybe you understand why don't use volume. Because the tissue in women are thinner than males. If she is a man and I apply in a man, I use it 28 volume to improve. In this case, I use 26 and the results are good. a little bit, your mouth. Yeah, there. Open.
Which is the dimension
Yeah.
of the needle that you are using?
It's big. It's 1 inch big. So we touch here, we see the temporal artery, and with volume pinch, very soft, great to feel. Okay, it's thinner. I'm touching the bone. So when I was here, very slow, very slow, start my application. In the bone, one of the characteristics, move the point of the needle. Don't be only in one point. The articles show that in this with this technique, we have less problems about the application in the artery. Okay, you go.
During the execution of this technique, sometimes I saw the colleagues to put the finger in the upper part to
Yeah.
decrease the risk of migration. Why with this product is not so important to this?
Yes, not with RENÉE don't have this kind of
Probably
problems.
thanks to the great
No,
cohesivity.
yes, the cohesivity is awesome, right? No, don't have it this problem. That maybe with other products, monophasic too, have that kind of problems.
You have injected 0.2 ml.
No, a little bit more.
Yeah? Not till now you have injected
Now
0.2,
I apply 0.5.
0.5.
Yeah. And that's it. And starts very slow, very slow.
Can we ask the pain sensation for the patient in a scale between 1 to 10?
1, 10. Good. See the face of the patient is. She speaks French. I don't speak French.
Okay.
So, but this is okay. Look the face. It's great. And if you see one side, the superciliar bone, and you see in this side, you don't see very pronounced, right? And only use the half of the syringe. It's nothing. In the product, in this area is nothing. Maybe we need to use one syringe minimum to improve correctly this area. So I change my filler, and I'm started to use Smile. It's a 22. It's obviously not more voluminizing from than lift, but I decided because in this area, in the forehead and in the superficial part of the temples, I don't wanted to use it a product that have the voluminizer. Right? I need a product that spread the area and have a very good result. So I'm started here is 2 techniques in the middle cheek and going up, or in the temporal crest inside the branches of the temporal area. So apply it here. It depends. I don't see a big difference to treat in the back or in the upper. I don't see the very big difference. I decided the commodity of the patients and mine. No, if I apply it here or in this part, I'm in these patients. I wanted to go in this part.
So you will inject using a cannula of 22, correct?
Yeah.
G.
Yes, and
you will layering which kind of layer?
In the fascia, in interfacial.
So
Yeah.
more superficial respect.
More superficial, yes. Yes, yes, yes. It's a point. Breathe. Yeah. I put it my on. Yes, and that's it. It's awesome, the patient. Awesome.
So to summarize a little bit, you have used a 26 milligram per milliliter lift to
Yeah.
lift, to promote
To,
a
yeah.
vertical lifting of the tissue,
Yep.
and now you are using 22 milligram to spread, to volumize better all the area,
Yeah,
correct?
correct. Totally agree. So, yeah, I'm inside. You feel it's. I have a just a little, yeah. The artery is there. I don't start up my application, but I wanted to have the space to apply my product. So in this part, I see my cannula. The point is in the bone. So sorry, see, it's okay. Yeah. I'm in the superciliar part. You see the tip of my cannula and start application very smooth, a little quantities, 0.5 each line, no more.
0.05
Yeah,
each line.
0.05, yeah. It's very small quantity. And
Correct.
very in the movement, in movement.
In a gently fan technique, you are
Yeah,
distributing 0.05
yeah,
quantity of product for each line.
yeah.
Great.
Yes. No more than that. And here, yeah. It's the feeling is strange. It's not painful, but it's feeling strange. It's okay. I'm use it in this point only 0.2 of our products. Okay. I spread.
You are modeling now the products.
Yeah, it's very important. No, I'm superficial in this part.
Is possible do it? Which is the plasticity of this 22 milligram per milliliter?
It's bigger than the 26. So it's apply. It's okay. Okay. I think a little bit more there in the upper. So re-enter in the point. 22 is like it, very safer. Okay, it's yeah. Okay, finish in a few moments.
How is the extrusion force?
Spread.
How is the extrusion force of this product with 22 milligram per milliliter working with a cannula of 22G?
It's like
It's okay. It's too hard to inject.
no. It's like water. It's very important when if you feel, for example, the volume on other products. When you use it 22, it's softer. So if a cannula 22, we need very careful to don't apply a lot in the syringe, so the product go very fast. No, and see that it's okay. It's okay. You feel right. See, the patience is not painful. No, it's I think that the sensation is strange. I don't. I tell my patients that they feel a warm in their face, and all my patients say, "Okay, I don't know what is the warm in my face," but I tell the patients, "You feel a very different sensation. It's very very important. I don't have pain, no. If the patients have pain, retired, and move it in the point to don't applicate. Oh, it's a little hematoma there. And just a little bit here, another re-entering the point. I'm using 0.3 of our product. So very, very small amount, not, and have a very, very good result. So apply it, and then here, yes. A little pain when we touch the hairline. It's
Alejandro, you have 4 minutes
Yeah,
more
yeah, yeah.
after we must organize the change of the injector. Tom is
Yes.
ready to come inside of the
And
injection room.
it's very important. See, this area, it's not see the superciliar area improve all the temporal. Maybe the patients need another session. Maybe.
Can we
No?
see the patient in vertical position? Is possible?
Yeah. See this improve, and the brow, you see that it's more elevated than here. This part is very, very deep, and right now I like it, really like it.
So, if I'm not wrong, you have inject 0.5 ml
0.5 and of a lift,
to lift the
0.5 a
eyebrow.
lift, and 3.3 of a smile, and that's it. It's a very, very, very small quantity. I don't have these kind of results with other products with a very small amount. Maybe I use it 2 syringes to improve all the area. So with 2 different products, lift and smile,
Alejandro,
but very, very small
Tom
quantity.
is arriving in the injection
Yeah,
room, so
come here.
comes here to discuss
Thank you.
the
And
take-home
return.
message.
And return, and then apply it, right? Yes, you understand me?
Yes.
No.
Ca-
Let me explain you. This is mine.
comes here in the teaching room just to discuss few minutes, 2-3
And
minutes
this.
before finish the procedure.
This is mine. This is mine. I'm using one cannula, right?
Alejandro,
Yeah. Going.
so
Return.
we can
Yes.
start 2 or 3 minutes of discussion. Have you seen the procedure? Are you agree? You are not agree with Alejandro did? In my opinion, is genial. So he used very low amount of product to project the eyebrow with a 1 up, 1 over technique, and after that to feel, to volumize the temple area. He decided to work with a fan cannula technique to distribute a product with less viscosity in entire area. This could be a very good project. Fortunately, this is possible because the rheological property, the mechanical property of the hydrogel are incredible in terms of viscoelasticity and cohesivity. The product stay exactly where you position it. So you are able to induce a lifting effect. You are able to create a vertical lift effect, a pillar to promote the projection. Please. We have published an article with the differences regarding this product line respect to other products in the market. The great difference, the unique selling proposition, in my opinion, is the cohesivity, that 3 times more respect to other product in the market, the cohesivity. And if you, no, is a monodensify, monophasic, polymeric matrix of hyaluronic acid. Everything is related with the technology that you are using to create this particular polymeric matrix.
You see the cohesivity of the product, right?
To be honest, 100% honest, inside of the products there is also glycine and proline. And this is 2 amino acid with osmolyte property. But these 2 amino acids play an important role in the thermodynamicity of the products. So using these 2 amino acids, you are able to put under control the hygroscopicity of the formulation. So you are sure that the aesthetical correction that you see immediately after the injection, it will be stable in the next hour without any edema, without any collection of water. And this is possible thanks the osmolyte property of these 2 amino acids. No, nothing. It's a pleasure. Any other question for Alejandro, please? Great performance.
Yeah, you like it?
Yes, a lot. This is our friend from China with a great
thanks
experience.
for your treatment. I have a question. When you treat that patient in the temporal area by 22, has 22. It's very, very superficial level you treated. Yeah, I don't understand. I think it's too superficial. I don't know the reason. Can you explain the reason?
Why is the reason that it's superficial?
Yeah.
Okay. The patients, if, for example, in this case, you have a very deep area. If you treat only the deepest, the product spread a lot. It's cohesivity, but it's a very you need maybe. Okay. So more, don't. You need less product in this area to improve, but you see, no, the area don't have it that kind of improve. They have articles. I read more 5 or 6 articles that apply in the superficial fascia, no, in the superficial and the deep fascia. You go there and spread the product. You need less quantity to have this kind of projection. I read one that use it very superficial. I don't like it. No, I prefer interfacial the product. Safe, yes. It's be careful in the parts of the artery, temporal artery, and that's it. But if you don't treat in the both, you don't have a very good results. No, some I think in my 70% of my patients, I do both techniques, deeper and superficial, and only 30% only deeper to have a very good result. Treat the patients is I think if you have a very good analyze the patients and 0.5 deeper and 0.2, 0.3 in the superficial, and you have a very good results. The only thing, the patients have headache. It's very important to take the patients.
The question is very clever. Why you are using a polymeric matrix of HA with 22 milligram in the superficial layer? This is possible because this product has a balanced relationship between viscoelasticity and cohesivity. So if you see the rheological numbers, the rheological characteristic of the 22 milligram per milliliter, you can see that the viscosity is very low. So you have a great spread inside of the tissue. But in the same time, you maintain the cohesivity to give this lifting effect. Clinically speaking, this is translated in low possibility to create lambing, bambing on the surface, but with a great homogeneous lift of the area.
A very less quantity.
Yeah, I want to know, is this product there by simulation effect
We will discuss this point immediately after the second injection procedure of Tom. Tom, are you ready? Remember your question because this is music for my hair.
Hello, can you hear me?
Yes.
Okay, welcome.
Great, Tom.
Yes, welcome to Monte Carlo and muchas gracias, Alejandro. That was a great session. It's hard to inject after you, but I will do my best. I have with me Giuseppe. He's a 50-year-old handsome male from France. He's an actor, and I want to do his lower third. So I asked him how far he want to go, because with the jawline volumization, you can do some contouring and you can really do the Brad Pitt effect. So he told me that back in 2018, he had some 4 or 5 mLs on each side and he loved the effects. So we always talk about less is more when it comes to filler, but I think when it comes to jawline of men and what I call not beautification, because that's about women, and Giuseppe don't want to be more beautiful, he want to be more handsome. So we're talking about handsomification when it comes to the jawline. So as you can see, if the camera can focus, for a 54-year-old, he has a very good jawline as a start. So I'm lucky to work with him. And what I want to do this in 2 steps. First, I want to widen the bigonial distance. That means the distance from the angle of the mandibula for both sides in order to get the A-shape form instead of the female V-shape form. And in order to do that, I always place my volume filler, RENÉE Volume, on the bone with a sharp needle, and I always use the needle in the package, which is a 25 gauge needle, and then my extrusion force doesn't have to be that hard to be such a high G prime filler. Then I will make my entry point a little bit posterior to the mesenteric ligaments, and I will try to fill up these points posterior to the masseter. Giuseppe has a very not very hypertrophic masseter, but he has a good portion of the masseter, which actually is one of the parts of the structure that creates the jawline. So if you're born with a good mandibula or jawline, and you have a good masseter, and you have not that much laxity of the skin, and, and you also have a low BMI, then most likely you will have a good jawline. So Giuseppe has all of it, but he's 54 years old, and of course there will be some bone resorption. So when I inject my filler, I like to think of my filler as liquid bone. It's like bone mimic, because what I want to achieve with my filler is to widen the bigonial distance. And then I will try to make, with my cannula, the mandibular angle somewhat sharper. So that's the contouring part. So sometimes, like in our clinics in Norway, we have something called the 4 ml package, which we had for several years. And after starting using RENÉE 3 years ago, we're down to, I think, 3 syringes compared to our competitors. So, are you ready?
I'm ready.
Yeah.
Yes.
I always prime my needle first. That's, of course, obvious. And when I draw and I do my injections, I either do it standing up or in a 45 degree, not laying down due to gravity. But that's something you learn day 1 in the aesthetic school.
Tom, before
Yes.
to start, we have a question
Sure,
from the
come on.
room.
Sorry to interrupt. I want to ask you about the drawing in the angle of the mandible. Is it exactly on the bone, or you go a little backwards to widen
The thing with the deep
mandible.
injection, I'm on the bone, and I'm as close to the angle as possible. Because with RENÉE Volume, you have very little spread. So that means that I'm allowed to go very posteriorly, exactly on the angle. And then my drawing, you can see, is a little bit behind the bone. So there is where I put my filler superficially with a cannula in order to create that sharp angle. Giuseppe already have a sharp angle, but he want to go all the way. He want to have not the cartoon look, because I don't do the cartoon look, but we're going for the Brad Pitt look here. That was answer to
Okay.
your question?
Show us the technique, and after we will discuss.
Yeah. I tend to go a little posteriorly in order to fill the bone.
Which kind of product are you using?
Oh, sorry, I'm using RENÉE Volume. I always use
So
RENÉE Volume.
28 milligram per milliliter.
Yeah, when I'm on the bone. I make sure that the patient is comfortable, and I inject slowly. I have to speed it up a little bit due to the time, but I try to put not the tip of my needle, but the bevel of my needle on the
The
bone.
diameter of the needle that you are using
Is 25 gauge. It comes in the package.
it's not so small.
No, but you need a 25 gauge in order to not squeeze too hard.
Yeah. How long is the lasting effect of the product?
Well,
Someone is asking me.
Well, that's depending on a lot of factors. First of all, your own metabolism, how quickly you're breaking down the hyaluronic acid. It also depends on the movements and, of course, on the placement. But in average, I will say for this treatment, with this volume, I'm going to use 9 months in average. Of course, it could be a year, it could be 6 months. It's depending on so many factors that you cannot give an exact time. But in my opinion and experience, is a long-lasting result. I now finished 1 syringe. How was the pain level? 1, 5, 10? Pain, okay?
It's good.
Good, yeah. Pain, 0?
A lot.
0 pain? 1, 2, 10?
J'ai pas compris, moi.
Okay. He's good. Giuseppe is okay.
Big.
The thing is that I always pre-anesthetize my patients when I do these treatments, not because they're not tolerating and accepting the pain, but when you're down on the bone, you're teasing the mechanoreceptors and you get this dull pain that nobody really likes, but they accept it. But I like to be a pain-free doctor because my patients think that less pain is always good. So I'm going with the second syringe now. With a hypertrophic masseter, it can be hard to reach the bone sometimes. The good thing with RENÉE Volume is that it doesn't spread that much, so I'm able to put my boluses directly on the angle of the mandibula. And I'm not massaging. I don't see any point by a hard massage. I just gently mold a little bit with my finger, feeling for lumps. And it feels okay. Then I will proceed with the cannula. Any questions about my deep injections?
No, till now, no.
No.
We will wait you in the
Yeah.
teaching room to do very deep question.
Then I do my entry point in front of the mesenteric, posterior to the mesenteric ligament. I know. I leave it for a few seconds to see if there's any blood. My experience, the tissue tends to collapse a little bit if you take it out really quickly. A little bit of twisting, squeezing for a blood drop. And for my contouring, I use my favorite tool. It's a 22 gauge cannula. change of glasses. Otherwise, I don't see the hole. Always like that on camera. Can't find the hole. I will make a new one. There we go. And I go all the way back. And I feel always the tip of the cannula with my finger. And of course, you can always go from behind or above, but I used to just bend my cannula up to ramus.
In which layer you are injecting?
I'm now subdermal.
Subdermal.
Yeah. I'm almost all the way up to tragus. And then I just do classic linear threading.
How much, which is the quantity of product that you are
Well,
injecting in
depends,
retrograde line?
but on Giuseppe, I will use 1 syringe. On females, I mean, the choice of RENÉE volume when I'm subdermal is depend on the skin thickness. So I mean, sometimes you can also use lift, but when I'm down on the bone, always volume, RENÉE volume. Almost done. And I'm just using some plain Vaseline. To mold it nicely. You don't need a lot of force here.
So, in total, you have injected how much?
Yeah,
1
3
ml.
syringes. So that's of course a lot, but when it comes to male handsomification, this is the volumes you need to use in order to get a good bigonial width.
Is easy to model or not?
It's not the easiest filler to mold, but you don't need. I don't use a lot of force. I'm just feeling if there is any lumps and try to just smoothen it out.
Is possible?
Can you see any difference? Okay. If you do that side. I don't know if you can see it in a good light here, but Relax. So, any questions to me?
Any question from the room? No, Tom.
Okay. Thank you.
Comes in the room.
See you soon.
Comes here.
I come back and do other side. Okay. Was painful?
So
Pain?
we can
Ow, ow.
open the discussion. We have
10 minutes. Huh?
yes, 5 minutes.
Yeah.
So, any question, any doubts, any curiosity? Also, if you are not agree with the technique that you have seen, we are here to discuss with you and to try to. Yes, please.
Thank you so much for the live demos and everything. I'm just new to the product, because I'm just started to know this the RENÉE filler actually is in this congress actually, and I was drawn to the session because I know you, Dr. Zerbinati, for quite some time. But anyway, regarding the product specification, I'm thinking, are there any difference from the pre-existing filler brands that we have available so far? Is that every SKU in the product range that have like glycine and proline? Is every SKU of the product,
Yes.
or just particularly the skin booster?
Yeah. For skin booster, we are working with not so high quantity of in milligram of HA.
Uh-huh.
Skin booster, we are working with 18 milligram per milliliter.
Right, it's the prom version, right? I just look into
Correct.
the catalog. Yeah.
And unfortunately, today we will not have time to show you the quality of this new formulation.
Mm-hmm.
The concept is every time you works with a product with less viscoelasticity and you are able to integrate, to remodulate the three-dimensional structure of the extracellular matrix, you're able to induce a new condition to activate the mechanotransducer of the fibroblast. And the new architectural structure activate fibroblasts to produce new collagen and new glycosaminoglycan. So working with the hyaluronic acid matrix, you are able to recreate a balance between fibrillar and amorphous component inside of the connective tissue. And this is what we are demonstrating in vitro and in vivo.
So the main idea of putting the glycine and of the proteins in the hydrogel is also to maintain the hydrostatic the hydrobalance, right? To not to make it too swelling because of the notorious side effect of the monophasic. Probably they have a lot of like swelling afterwards. But this one of putting the the glycine and protein minimize the swelling afterwards, right?
Correct. This is one of the plus to use glycine and proline inside of the formulation, because they are two amino acids with osmolyte property.
Yep.
So they are able to put under control the thermodynamicity of the formulation. So the risk to have great collection of water after the implants is very, very low.
Okay. And regarding the temple injection, the the first injector, if I would like to place the product in the interfacial plane, would other SKU, would you use different products like higher HA concentration for the deeper injection?
In deeper,
Yeah,
you
interfacial plane,
the fascial plane
which is deeper than the one that you demonstrated.
yes, the deeper and and interfacial
Yeah.
into planes. When the product is different, the interfacial you don't use it a voluminizer. I use 22, the smile.
Which is
No.
the one that you use?
That 22.
That's 22.
Yeah.
Even the deeper interfacial, you
No,
still use
in
it.
deeper in the bone, I use 26.
No, the one because I think
Interfascia,
you
22.
place it above the smash, right?
Yeah, 22.
22.
I use 22 milligrams. Yeah.
But interfacial plane is just
In the fascial
deeper.
plane, interfacial plane, yes.
22 also.
22. Yes. If I apply a voluminizer, it don't spread very well. No, and it's very difficult to
Because the cohesivity of
the
the product.
cohesivity of the product. Yeah, and
Uh-huh.
22 have a very good results. I only use 0.3 of the syringe.
Right. And for the control technique, I'm not, my preference is not, I think the needle that you're using, I think is a little bit too big. I think you use 21G, right?
Yeah.
For the control technique.
Yes.
Is it possible to use the 25G or 27 even?
26, 25, yes. Yes. If you have
right.
25, one is
I think
okay.
it's a little bit like too,
I
too
prefer,
high.
but I don't have it. No,
I see.
right now. No, but if you have 25, it's awesome.
It's applicable.
Yes, it's 27. Don't use it. 27 is more flexible. No, 25 is awesome. 25 or 22, 21. But 25 is okay. I like it. I use it in my clinic.
Maybe when once I have the hands-on test on the extrusion for the rheology of the product
Yes.
myself, I will be able to.
With a 25 needle, 26 or 28 is more difficult to apply. No, 21 is very, very soft, the product. You need to apply more strength in the syringe with a 25 needle. So be careful, no, with the product, because if you apply a little bit more, you cross the temporal bone. No, it's very, very complicated area. So be careful, and that's it. I use it 25. Yeah.
Thank you.
Question for Tom.
Sorry.
Yeah.
When you draw when you put the cannula, there was a pop, like you enter the platysmal auricular ligament, isn't it? It felt like a popping right on the pump. So when you draw exactly on the angle, or you go backwards?
Oh, I go a little bit posterior to that because I want to try to create that sharp mandibular angle, and then I'm a little bit posterior to the bone. More questions? Girls, front row.
Our time is finishing, correct?
Yeah.
Yeah, I'm sorry. So if you have any other question, any other doubts, any other curiosity, we will wait all of you to the booth of René to answer to all your questions. Thank you for your time and see you next year. Always.
Thank you.